Greetings. My name is John Raphael, and I'm the Director of Educational Services at the National Alliance for the Rec Support Professionals, and we are bringing you a live webinar right now, and it's part of our series that we've been doing for years with Dave Hingsberger. Let's talk with Dave Hingsberger. The topic today is absolutely it's something we all, I think, desperately need to hear about, which is the mental health needs of not only obviously the people that we support, adults with developmental disabilities, but and those that support them. And I think all of us are struggling. I know I've been struggling. I bet all of you have been struggling with mental health concerns since this pandemic has kind of taken over our existence. The article that was written for the International Journal for Direct Support Professionals is one that I think you all will want to take and read if you haven't read it already. We'll show you how to get that in just a second. And the authors were numerous authors, but there's one author that's going to actually be speaking with us today and presenting with us today, and that's Dr. Yona Lunsky. I'll introduce her in a second, but I just wanted to give these other authors their due and their announcement. The authors who did pen this article: Nicole Babette, Angela Gonzalez, Liz Greer, Nadia Mia, Lee Steele, Anupam Thakur, and Kendra Thompson. And unfortunately, they couldn't be with us, but Yona will represent for them. So welcome. The National Alliance for the Rec Support Professionals has been very proud to offer these Let's Talk webinars over the years because we want them to be conversational. We want them to be not a typical webinar. These are more like radio shows. They're more like podcasts. We try to make them as conversational as possible. We got a couple poll questions that we're going to do today with you. But we want you to continue this conversation after this hour, and want you to bring this information back to the people you support, back to your coworkers, back to family members of the people you're supporting, and use this conversation to guide your professional development. The National Alliance for the Rec Support Professionals has been in partnership with the people you're going to see in just a second. We're going to introduce the organizations that are also responsible for this webinar. But the National Alliance for the Rec Support Professionals, we're really an organization devoted to bringing direct support professionals to kind of the top of the page, to bring them development tools and educational tools and policy changes that can improve their existence so that they can be the best that they can be to support people with disabilities to the best of their ability as professionals. Please check us out at nadsp.org. Most of you are probably familiar with us. If you're not familiar with us, check us out, especially right now. We are doing a membership drive. We've got half off our membership, and just check us out, and I think you'll be pleased with what we can offer you as a member. This is very important because this partnership, we couldn't be doing this without the partnership of the National Alliance for the Rec Support Professionals, but also particularly today, VITA, Community Living Services in Canada, where Dave he's employed there, HANDS, the Family Help Network in Canada, and particularly today, HCARD, which is Healthcare Access Research and Developmental Disabilities. It's a Canadian organization, and Yona is the director of that, and I'll introduce her in a second. Please find this article, and you can find this journal at vitacls.org at the address right up there on the screen. Not only is this article available, but the archive of hundreds of these articles are there at your disposal, and we want you to take advantage of them. They're free. You download them and you read them, and they're just gold. Next month, we just found out we're going to be doing Tuesday, August 25th, 2020, at 2 p.m. Eastern Standard Time. Our next Let's Talk. So maybe you're going on vacation, but if you are, it doesn't matter, because you can tune in, and you should tune in because it's going to be a good one. To show up and step up. Difficult conversations. That's the tease you're getting. Please tune in if you can next month. Again, you can get the International Journal for direct support professionals at vitacls.org, also at www.thefamilyhealthnetwork.ca, and you can find them also available through the NADSP website, as are all the archived Let's Talk webinars available to our members. Now, enough of that stuff. Let's get to the really good stuff. And today's presenting author, who's going to be basically having a conversation with Dave, is Dr. Yona Lunsky. And Dr. Yona Lunsky is the director of the Azrieli Center for Addiction and Mental Health, that's CAMH in Canada, and also the director of HCARD, which is the Healthcare Access Research and Development of Disabilities Organization. Her information is right there in terms of reaching her. I'll put that in the chat box a little later. So if you do want to reach out to her and contact her, you can do that. But Yona's going to bring us through an important journey, and I can't wait to hear this conversation. And this conversation will be moderated and kind of and wrangled by Dave Hingsberger, our colleague and friend. And without further ado, I'm going to be quiet, and I'll intervene again when we need a couple poll questions. You let me know when you want to have those, and or I'll interrupt you, and when we want to have a couple of those given. But right now, Dave Hingsberger, to you.
Hi, John. How are you?
Good.
Good. I wonder if you could take us to our first question. This is where we typically start when we look at these articles which have been published by the journal. And I just want to mention that Dr. Lunsky is a personal hero of mine, and I'm always a little bit tongue-tied when I'm around her. So anyways, Yona, so why did you choose to write about this topic?
I'm just laughing, Dave, because I'm tongue-tied when I'm around you. You're one of my heroes. You know, I was just actually looking back at the archived journal, and it was 2016, February, or the end of January rather, and it was Bell Let's Talk Day here in Canada. And we had another article that was on mental health, and we said it was called Let's Talk About Mental Health and Developmental Disabilities. And we did one of these webinars. So. Yes. You know, it's kind of like, why did I choose to write about it then? Why did I choose to write about it now? I mean, I think, you know, it was a good article that we wrote then. I think that since COVID has hit us all and knocked us over the way it has, you know, it's becoming more and more apparent every day that we can't be forgetting about mental health, and that it was something we sort of needed to come back to and you know, think about what's unique or what are the big considerations that are maybe a little different than what we wrote about in 2016 that would be important. And I did this, you notice that long list of names that John was mentioning. That's a group of us who've been running something called, it's a program called Project Echo, where we're sort of meeting together virtually with healthcare providers and DSPs. So this was with people from across Ontario. And we were talking about during COVID, what are those key mental health sort of nuggets or things that people need to be thinking about to support this population. And so we sort of took some of those ideas and said maybe that belongs in a newsletter. So that's how it turned into the journal article.
Well, and it completely makes sense because the original article was written under a very different set of circumstances than this particular one is. And I think everyone is experiencing some kind of reaction to COVID. I mean, it's easy to become distracted by all the work that needs to be done in order to keep yourself and everyone else safe, that you can forget other aspects that you need to be thinking about. And I think that actually leads to our next question. So, John, would you mind? So, mental health is health. I think that's something important that you say here. But why is it that people have trouble as seeing them as equal? People get the issues of physical health, but the issue of mental health is not taken quite as seriously or as seen as a serious issue.
Yeah, I mean, I think that's always been a problem, Dave. So at my hospital at CAMH, that's kind of our slogan right now, mental health is health, because it's as much health as any other kind of physical health issue. You know, if someone has cancer, we all know what to do about it. And we make sure we get those things done. But if someone has a mental health issue, there's a lot of stigma that goes with that. We don't see it necessarily in the same way. We don't have the same platforms or pathways for how people get help, and we don't give people the help they need. So that's the problem we had pre-COVID. And then this diagram or visual is up on the screen to kind of highlight, I think, what's happened since March is we've been so focused on that sort of narrow purple little mountain there of how much effort we've had to put into, you know, addressing, let's not spread this disease because people can die from it. So let's focus on that as much as we can. And we know for people with developmental disabilities in particular who are more vulnerable, both to getting COVID, we've learned, but also to having really terrible outcomes because of it, we needed to make that a focus. So that makes good sense, right? But all the stuff we've been doing because of COVID also creates this sort of red arch that we see in the diagram. And it doesn't go down. All the other little mountains go down, right? But what's been happening because of COVID and all the things we stopped doing and all the important people in the lives of the people we're supporting with developmental disabilities who can't be with them, all that stuff, you know, builds a sort of trauma and a mental health crisis for them, for us, and it's still with us and it's going to stay with us. It's not going down anytime soon. So I think that's the ramification. If we don't pay attention to mental health because we have to prioritize what's going on in terms of prevention of spread of disease, there are consequences.
Yeah, there really are. I was having a conversation this morning with a woman who works in human services, or worked. She'd actually just retired recently, and I was saying that you know, I still meet a lot of people. I'm on a lot of Zoom calls, and I can be at a meeting where there are 15 people zooming in, and there'll be conversation, and they'll be laughing and so forth. And when it's all over, I still have a sense of somewhat emptiness, you know, because seeing somebody through the screen is important and it's powerful and it's necessary, but it's not the same as being in the room with somebody and feeling people's physical presence. So it might seem like we're very busy with other people, but there can be this sense of a real isolation and loneliness that builds in behind that. That I think is really important to take care of.
Absolutely, and that's even just assuming, Dave, you're very skilled and adept at doing those things. So for many people with developmental disabilities, that virtual way of connecting isn't even accessible to them, right? Or if we try to make it accessible, it's not something they appreciate or they're used to or they like. So it's that much harder, I think, in terms of the isolation and the change in how people are interacting, for some people at least.
Yeah, and I think it's a really important that we have this discussion and that DSPs be thinking about this, because I think it's really easy in the busyness of the first wave, and just taking care of the environments and taking care of the people within the environments and so forth, that it can be very difficult to see people as discrete units within those environments. And making sure that we're paying attention to how this is playing out in their lives and what kind of things are they facing. So what are the ramifications of ignoring mental health in the age of COVID? And if you could maybe think of that from both the perspectives of somebody with a disability and somebody who's a care provider.
I mean, again, I think in the diagram, ignoring it doesn't make it go away, right? And now we can't say for sure, because this has happened to us so many times before, this is exactly what will happen because we've ignored mental health at this time. This is an unprecedented time, right? So we don't actually know what all the ramifications will be. But we do know from things that happened prior to COVID that if we ignore our mental health, it doesn't tend to necessarily get better on its own. That instead of getting sort of proactive, supportive mental health treatment, we get crisis-based reactive mental health treatment, right? So that may require calling 911, going to the hospital emergency department. It may mean that people with disabilities cannot be supported in the setting they're in, And so they have to go somewhere else. They may have to be hospitalized, for example. And then I think for DSPs, you know, whether it's the impact of watching that happen and not be able to do that much about it, or on you, like that's huge, right? And then also, I think we've got this real sort of hero. I mean, and I have to say, I'm so excited to be on the phone with so many of you today, because you really are heroes. And if you weren't doing your jobs, there'd be so much loss and so much pain right now. But that has a toll. And I think as heroes, you know, we need to sort of just keep going, keep going, keep going. So there's a ramification of ignoring our own mental health in service delivery, because we can't keep going, right? If we're not taking care of what's going on with ourselves. And in fact, if we're not well and we're trying to help someone else, we can do a bad job, which is harmful to us and also potentially harmful to them, because we're not able to work the way we should be working. So it's very serious ramifications that I think will stay with us, Dave, for a long time.
I think so too. And I'm really glad you brought up the heroics thing, because I mean, that's something that's being said a lot. And there is truth to it, that people are coming to work and they're coming to work under extreme circumstances, and they're making decisions to take care of people who need care, but there's danger attached to providing that care. But the thing that worries me about this whole hero thing is that our mythology regarding heroes are the kinds of things that we see in the multiplex, and these aren't people who tend to be introspective, or they tend to become overwhelmed and so forth. So I think we may ask more of ourselves because of the words like hero than is really reasonable.
Yeah. Yeah. I mean, this is taking its toll on us. And I think, you know, one of the best things we can do and also model is recognizing that and trying to take good care. Like we can't take good care of other people if we can't take any care of ourselves, right?
Yeah,
so,
that's exactly right. And you're right. It's something that we could actually model for people with disabilities. You know, we are allowed to be human at work. So I think that's important. So, John, could you move us on to the next slide there, please?
I could, but I think this is a great time for a poll question.
Oh, let's do that. I like poll questions.
Yeah, I think it's a good one. So here we go. I'm gonna launch the poll.
Have you purposely set up some strategies for your own mental health during this pandemic? And your choices are yes or no.
Oh, beautiful. Oh boy. Sorry, I always do this. I can see the results.
I know you do. You tease us.
Sorry.
Here we see them come in. Then
it's wonderful. We got about 70% of the votes. And great. I'm going to close the poll. Okay, closing the poll. Here come the results.
Okay, 74% have said yes, they have set up some strategies, and 26% said no, they haven't set up some strategies. Do these poll results surprise you, Yona?
Well, it pleases me in the sense that we are seeing, you know, that 3/4 of the people who chose to spend their time, who chose to spend their hour today on this topic, have done this. And it doesn't really speak necessarily to everyone in the sector, unfortunately. And there are still 1/4 of people who haven't. You know, the other question we didn't ask is, you know, how's that going for you? Because I think sometimes we set up strategies that are a little unattainable, or that really work in the short term, but may not be so good 4 months in. So there's also this setting it up and then the revising it and sort of re-examining it. That's also important. But I'm also
I'm going to exercise every day strategy.
Yeah, that's right. Every night before I go to bed, I'm going to think of 3 things that I'm grateful for and write them down. You know, you might do that, or you might have ideas about doing that, but you can't really do it, right?
Yeah, and I think it's important that you mentioned that, you know, the people who have selected in to come to this are selecting in to come to something on mental health and COVID. So it is a very specific percentage of the population of people who provide service. So why might staff have difficulty recognizing mental health concerns in people with disabilities?
Yeah, I think, again, it all depends what we're looking for. First of all, it depends what we're looking for. If we're not told, your job as a direct support professional is to be highly attuned to what's going on in terms of the mental health of all the people you're supporting, and this is how you're going to do that. If that was sort of how we describe the role, that would be one thing. But we don't exactly do that, right? We're not mental health professionals. We're developmental professionals, right? We're focusing on the person's disability and how to support them. So where does mental health fit in? And I think what makes it more complicated is that sometimes, like first of all, we all have stigma around mental health. So there's a lot of things we all try to hide. But I think if you have a developmental disability, it may be even more challenging sometimes for you to show what's going on in terms of your mental health, because you don't necessarily have the language to describe it. And that's not just speaking, Dave, to people who are less verbal, but even someone who has a lot of words. If they're always being told from the time they're kids, you should be happy. No, you're not sad. Be happy. Oh, be happy. I'm happy, right? So if we're kind of, not acknowledging the range of emotions we can all experience, then it can be really hard to describe what it is that's happening to you. So I think we miss those things sometimes. We use the term diagnostic overshadowing, and it talks about how sometimes that obvious sort of presentation of, say, depression or anxiety, we don't see it because we're so busy looking at the developmental disability that it kind of overshadows the other things that might be going on. So I think that's one reason. So that and training is not a focus. And also it's, frankly, it is a little bit complicated, and there's lots of things that can be contributing to what looks like a mental health problem, and it may or may not be, but it's kind of complicated to unpack all those different pieces. So in the image that's on the screen, we talk about the acronym HELP, and it's sort of explaining all the different aspects of what might be going on for that person. But if we sort of unpack it one piece at a time, that will help us to understand what's going on in terms of mental health concerns for somebody.
Yeah, I just wanted to go back to what you were talking about in terms of people may not have the words or the permission to use the words that describe what they're experiencing. A number of years ago, I worked with a woman whose name was Susan Ludwig, and she was developing a feelings education module for people with intellectual disabilities. And one of the things that she pointed out is that for a lot of people with disabilities, they've been told almost their entire life that the only emotion that they're really allowed to experience is being happy. And so we both had the experience of working with people with disabilities who were crying and obviously grieving, but if you asked them how they were feeling, they would say happy, and almost as a way to appease you. Because we have had a history in service to people with disabilities of if you're not feeling the right thing, you'll either be punished or medicated because of it.
Right.
So it was really important to develop that. And what we discovered in the use of her module, that it was quite possible to teach people with disabilities the language with which to discuss what they're feeling. But then we had to work on environments that welcomed that language as well.
Yeah.
So, and I think we're going to talk about both of those things when we get to the HELP as an acronym.
Yeah. Yeah. And just to add, Dave, I think on top of you sort of invalidating or not giving them the language or the permission to experience the range of emotions, if you think about what we do as sort of care providers, whether we're families or teachers at school or staff, is we're always trying to have that bright face ourselves, right? So we're also not displaying the range of emotions that we might experience, not at work, because that's not professional. And I think it's interesting when we think about COVID again and how that's transforming us, it's difficult for all of us. It's a perfect opportunity, actually, to sometimes show some of our anxiety or our sadness or our frustration at the things that are happening. And it is giving a message to the people we're supporting that those are actually really legitimate feelings to have sometimes while this is going on. And there's a difference between what we feel and what we do in terms of how much we're sort of hurting other people or hurting ourselves with those emotions. So we can find ways to cope with negative emotions, and that's a great thing to do. But it's not that we're not supposed to have negative emotions.
Exactly. And I think that that COVID gives us the opportunity to use empathy in a whole new way, because we may not understand what it is to be disabled, or to have an intellectual disability, but we do understand what it is to be in lockdown, and we do understand what it is to feel isolated, and we do understand what it is to feel cut off from the larger community. We do understand those things because we're going through them in a parallel manner to the people we provide service to. So I think that allows for some really interesting conversations to happen.
Yeah.
Okay, do you want to move to the next slide there? So can you walk us through the HELP approach?
Absolutely. So in this diagram, by the way, I can put a link. I guess the links are in the actual article for everyone. If they read the article, they'll see all the links that kind of talk about all of this. So this sort of acronym HELP is something that was developed by Elspeth Bradley, who's a psychiatrist I've been able to work with for many years here in Toronto. And it's a complicated diagram. If we just sort of focus on the rainbow colored parts of it with the H, the D, and the L and the P, that's probably the easiest place to start. The first point here is that we've got to think about if something's going on. We don't know what it is. The person's not doing well. It might be a behavior concern, it might be a suspected mental health problem. Stop everything before you go any further and just check. Is there anything in terms of their physical health that could be contributing to what is happening? Now, how this is relevant to COVID is that, you know, people have stopped going to their doctors, right? So people are, you know, not visiting the doctor to get checkups, not going in to take care of their ongoing diabetes, or it's hard to get their eyes examined and they broke their glasses, or maybe they've got wax in their ears and hasn't been cleaned out. So whether they're very complex health issues or minor ones, like if you're not eating at the same time of day anymore, or you're not walking to your activity you usually go to during the day, then even eating the very same foods, you'd start to get constipated, right? So all those health kinds of things that could be happening that might be contributing to the difficulty right now, that is the place to start to really understand what is happening health-wise. And as part of that, also looking at medications that you're taking or that the people you're supporting are taking and the side effects of those medications, making sure medication reviews are still happening with the doctor. So don't just renew at the pharmacist, but make sure we're checking if the medications are working and the side effects profiles and all that. And having visits. So at the beginning of COVID, people thought, okay, well, I can't see my doctor. I can't go to the doctor. Well, guess what? You can. You may not be going in person, depending on the situation, but you can have a phone call, you can have a video visit, and then for certain things, you absolutely still can have an in-person visit. So taking care of health issues is a very, very first part of the HELP acronym and sort of approach to things. And
one of the things I liked about how you wrote about about health was in terms of looking at so what are the changes that have gone on and how do they affect people physically? Like you said, eating at different times, or I know people who got almost all of their exercise by walking, by going out, and if we put a pedometer on them, they put miles on, and now they're no longer doing that. And those are the kinds of things that I think are really important for staff to notice and ask questions about in terms of how that affects people physically, because there are people who have endorphin rushes from doing the stuff that they do, and now they're suddenly not doing anything at all in those areas.
Yeah. So, and you know, dental is another one, right? So you might just not be the best at oral hygiene and you start to get an infection or some pain and it's impossible to find a dentist. There's all kinds of issues, you know, making sure you're getting your toenails trimmed. You know, if your toenails are too long, you can fall, right? You can trip, so every part of our body has like something to be looking at and monitoring. And it's that much harder to take care of those things, I think, at this time. So that's the first thing. And then the next part of HELP focuses on the environment. And so sort of pre-COVID, what we would talk about here is looking at, you know, is the situation you're in, every environment you take part in, you know, do you have enough support to do the things that you want? Or do you have kind of too much support, or the expectations are too high for you, or actually they're too low, you're not stimulated? So what are the things we do to make that environment responsive to sort of who you are right now and what you need? Because that intervention is not a medical intervention. It's not like seeing your family doctor to address health issues, but that intervention is about working with the environment, right? So the problem that we're seeing is maybe in the person, but it's related to things that are going on around them. And the challenge during COVID, like let's say one of the problems is that you're stuck at home with people you don't like. We don't have a great solution for that one because you can't necessarily go somewhere else or get rid of the people you don't like where you're living. Right? Or if the problem is there's really this wonderful stimulating environment you usually get to participate in, but it's closed, we don't have the solution that's really obvious for that either, right? Because we can't reopen it just because you're missing it. So we have to get very creative, I think, to look at changes we can make to the environment, or at least recognizing what it is that is difficult in that environment and making sure we emphasize the importance of doing things. And what we do or what we did in April isn't the same thing as what we now need to do in July. So overall, yes, we want all of our environments we're in to be stimulating and supportive, but how it's affecting us 4 months later is different than how maybe it affected us in the first month. And I think that's important to keep in mind too.
Yeah, and I think one of the things regarding the environment that, again, DSPs I think really need to think about is that not only are they stuck in the environment with other people who are not of their choosing, they're stuck in the environment with you.
Yeah.
And that's somehow hard to think. But I mean, I live with and love Joe, but we've been together a lot, so he's not hearing this. But that's true too. There's people who are used to supervision at a greater distance, or are being able to escape now, have staff around them constantly. I really like the poetry in one of your lines here when you say that do people with disabilities have too much support or not enough independence? And I think that that's an important thing to look at, because, you can create independence even in the most heavily staffed environment. You can create opportunities for people to feel like their choices are being respected, like that the things that they have some power over the things that are happening in their lives and so forth. So
Yeah.
I think that's an important thing to look at in terms of our own relationships and our own need to help, and to know when to help and when to simply back off.
Yeah, no, absolutely. So then moving into the L, and L can stand for a few different things, but one way of thinking about it is just that person's lived experience, and particularly but not exclusively, really looking at things like trauma. And one thing we highlighted sort of COVID time that's different. So we all know that people with developmental disabilities are exposed to more sort of difficult life events over the course of their lifetime than people without those disabilities, and a lot of trauma that we don't always recognize, okay? But then we put COVID on top of it, and we're all traumatized, right? But there's some unique traumas or gaps in terms of freedom, and you talked about, for example, you've chosen to live with Joe and to love him, but if at some point you really just need to take a very small break, you may be able to get outside, right? But someone with a developmental disability might be reliant on someone else to allow them to go outside, or maybe they're actually not allowed because of the rules of the setting that they're in right now. So, there's unique traumas, I think, that are happening to them. And also there's some difficulties they have. Like, part of what makes something traumatic is not understanding what's going on. So it's difficult to not be able to see someone you love right now. But if you don't understand that the reason why you're not seeing them, they love you, they just can't visit you because of this rule, but they're still there, they still exist, you just can't see them right now, or you can talk to them on the phone, that makes it a bit less traumatic. But for some people with developmental disabilities, if they can't see someone they really care about, they might think they've done something wrong. They might think the person has disappeared from their life completely. So how they understand that experience can be quite traumatic for them. And then the other thing that's traumatic is that the experience of what's happening now might also be reminding them of things that were difficult or painful that happened to them in the past. So for example, if they've lost someone right now, maybe they think it's as though that person has died, and they're thinking about other grief experiences that happened to them in the past. Or if the staff in the home have to wear masks, right? Or they're going to see a healthcare provider or even in the store and everybody's wearing masks. And they actually had a terrible experience being pinned down, in a healthcare setting where all these people were wearing masks, or had a very negative interaction with police and they were masked. Like, there's all kinds of things that they might be associating COVID events with that are reminding them of things that have happened in their past. So there's a lot of life events that are hard right now, as well as associations with life events that happened in the past that are really difficult. And the treatment for that, so again, the outcome of that will be absolute distress, right? So incredible anxiety, incredible sadness or despondence, but do we treat that with a medication, for example, or do we say, wow, that's really, really difficult, but that's a really, really sad thing that happened. It makes sense you would feel so sad right now, or that you're so afraid. So let me try to understand what's going on from your perspective in terms of why this is so hard, right? So we still might do some of the same mental health-based therapies we would do otherwise, but first we step back and kind of understand the context of why that has in fact been so difficult.
Yeah, and I think that's something that you need to be mindful of. There's a couple of situations that have happened for us. We had our BDs stopped going into our environments for a period of time as we were just getting a handle on the virus and creating safe environments for people to be in, both to live in and to work in and so forth. But when the BDs started going back, in one of the houses that they went back to, they wore the full PPE with the mask and the facial screen and all of that. And what the BT noticed was that it took people a little bit of time to really realize who she was, past all of that stuff that they had to see. And once they did, they were really happy to see her and spend time with her. But when given the option to see her physically present in the home, to meet with them while wearing that, or to meet her virtually, they 100% of them wanted to meet her virtually. They wanted to see her face. They wanted to be able to hear her voice unmuffled. Those were the things that they wanted. And it's such an easy thing in that kind of situation to give somebody a choice about how they're going to receive that service in a way that makes sense to them. We also were aware that people were, missing people and missing the kind of contact. So we have, I know many organizations have done this kind of thing, but we had a sort of a drop-in dinner where people could just sort of log in and then have dinner with one another. It could be one person in a location, or it could be several persons in a locations, and people would simply choose to do that. And it was last Thursday, I think, it was reported to me that at the end, when the BTs were signing off, saying, okay, our time is done now, they all said, well, do we have to hang up just because you're hanging up? And they said, no, 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 no. So they continued on with no support at all, and were able to have a really good time with one another. And that just made us really happy that people with disabilities had this opportunity to just simply have fun, even though they're under all of this stress and all this pressure, these opportunities to just have fun and not necessarily be overseen by others.
Yeah. I mean, in terms of interventions, right? What an interesting intervention that is, just trying to figure out how people can have some fun.
Oh, right? Absolutely. Absolutely. Because I think that's something that, if you take a look at almost all the people that we know who are in lockdown, have developed a really good sense of humor about the whole thing. Because I think that's something that leads to good mental health, is just simply being able to laugh at the circumstances that you find yourself in. And it was nice for people with disabilities in that instant to just laugh and have fun and enjoy themselves.
Yeah.
I think you have one more.
we have to cover the P. We shouldn't forget about the P. So the P really stands for sort of psychiatric disorder. So, it's important for us to recognize people with developmental disabilities are more likely to have psychiatric disorders than other people. As many as like 40 to 45% in regular times of adults with developmental disabilities have a mental health disorder. So we have to sort of unpack all these other pieces, but still look at what's going on. And if there is a psychiatric disorder that's getting worse, that's emerging for the first time, they need help to access supports just like anybody else. And we need to make sure they get those supports quickly. And the interventions might be pharmacological, they might be medication related, they might be psychosocial, they might be about physical activity. There's all kinds of things we might do depending on what's going on. But we need to make sure that we can get people who have expertise in mental health to sort of do those assessments and come up with treatments. And again, how we deliver those things is way more complicated now because it's COVID, right? But one thing we have learned is that for many people, there are virtual ways to get your mental health care, and they can be quite effective. So we really want to make sure those things are happening. And just a comment, we didn't make a poll of this, but I'm always fascinated by this. So I'd love to know from people if they want to put in the chat box. But, some people are only using healthcare and mental health care by phone. But if you have a developmental disability, it's helpful for all of us, actually, for many of us, to be able to see and hear what's going on. So having the capacity to interact with people through video when you have to do virtual care is really important. And as a mental health provider, it's really important for me too, to be able to see kind of what's going on for that person, to see where they are, to see the setting they're in, to know what's happening for them. And it actually helps me when I'm delivering that care. So it is really important that we don't forget that mental health interventions exist. We have to adapt them. They may be virtual, but they can still be quite powerful. And sometimes actually when you're having a mental health difficulty, being able to do something virtually without having to get up and go somewhere and, travel for a while and wait for a while in a busy room, all that kind of stuff, to be able to avoid that and just get the mental health support that you need, that's actually a gift. And that could be really useful for some people.
Yeah, I get all of my healthcare pretty much is virtual through, I can't remember what the name of the system is that we have here in Ontario, but that's how I meet with my doctor and specialists and so forth. And once again, it's convenient, and they still they're good at projecting warmth, So it really is important. But I don't know that I could do it just listening. I think that seeing the doctors is really important as well.
Yeah. And also keep in mind that, for the next while, when you do go to an appointment, you're going to be wearing a mask, and so is the healthcare provider that you're seeing. Yes. So again, if we're talking about our emotions and being able to comprehend also what people are saying, it can be helpful to see a person's whole face. And for some of the people we support, it's really hard for them to wear a mask themselves. So sometimes virtual care is a really nice option in terms of connecting. It might actually be easier for some people than some of the visits in terms of how they go in person.
Yeah. Well, we've been talking primarily about people with intellectual disabilities, and you have a page in the article which is about help in terms of support staff. So, is there anything that you want to add to or expand upon in terms of staff themselves, or are we ready to go to the next slide?
Yeah, I think the next slide might even weave some of those questions in. Maybe we can pop in the next slide, and then, yeah, so here's a nice visual. I'd actually never seen this before in terms of the way legs actually look different. So we're often hearing right now that this is a marathon and not a sprint. So I think certainly when it comes to sort of staff mental health, our own mental health, kind of recognizing this is already 4 months in, right? And it's going to keep going. We've got to take care of ourselves as though we're planning and preparing for a marathon as opposed to a sprint, so we don't exhaust ourselves. And thank goodness we don't need to have sprinter thighs to do the work we're doing. My thighs don't look like that. I'll never have that many muscles, and that's okay.
Well, I've just discovered that I've got sprinter thighs.
There you go. So I think taking care of our mental health, knowing this is a very long-term kind of situation, is super important, and it's not sort of a one-shot deal. Like you can't say, oh, I took care of my mental health once in May when I did an hour-long workshop. Now I'm good to go. the effects of what's happening to us right now are cumulative. So again, like supporting a parent, supporting someone with a disability, supporting me as a person who works with parents and people with disabilities, I'm different now than I was 4 months ago. So what's going to be helpful for me now might be different than what would have been helpful 4 months ago. And we have to sort of keep getting back in touch with that, I think, in ourselves. I think, we're working often in settings where we're working with other staff, with other people, and it's kind of a team-based approach where we're sort of watching and taking care of each other, right? Not just taking care of ourselves. Knowing about sort of boundaries or certain points in time where work has to stop and there's something else we need to be doing. So sort of asking for help when we need it, applying that whole help sort of concept I just went through, and looking at it for us too. Which health issues have I ignored in the last 4 months? What's really crappy right now about my environment? What are the own traumas that I've sort of experienced for me? And when do I really need to say, it's not just a bit of the blues because it's COVID, but actually I really don't seem to be able to get out of this. Very sick, and I feel like it's a depression. Maybe I need help, right? So we can actually use the same strategies we've been talking about for the people we support, I think, for ourselves right now. And it's probably the most important thing we need to be doing, because we can't run on empty, and like I said at the beginning, we can really cause injury to ourselves and to other people if we're not taking care of ourselves in the way that we need to.
Yeah, and I think it's really important to do really honest self check-ins in terms of what you're feeling and why you're feeling it, and give yourself permission to feel those things. And to learn what you need to modulate, what you need not. One of the things that I find just as a supervisor, when I'm meeting with staff virtually, it's much easier for me to just become shorter than I am when I'm in person. And I wasn't aware that meeting virtually was going to make that kind of change in my own behavior, but I didn't like it. That's not how I want to be. That's not how I want to supervise. But that's being at a distance, somebody through a screen. I'm reacting to them differently, and I need to be really careful about that. But that's that's the kind of thing that you can only discover if you actually stop to think about it, and to think about what you're going through and how it's changing you. So it might be a good question for people to say, how am I different now than I was 4 months ago?
Yeah.
Because I've heard you talk before about we didn't need to know what the baseline was. So 4 months ago is the baseline. Where are we now?
Yeah, and what's reasonable to expect or do given that we're not at our baseline? None of us, right? So, what pedestal are we sort of holding ourselves up to? What is it that we need to be doing, and what can we actually do? Because I think, if we have really realistic goals of what we can do in this moment, we're probably going to feel better at the end of the day because we accomplished them than if we're not recognizing kind of the chronic sort of injury of what's happening to us over time. So nothing wrong with needing more help now, I think, than we did before in some ways. And in some ways, I think we're also adapting. So there's some things we've kind of gotten better at that maybe we really couldn't handle quite at the beginning, which is actually important. If we think about our mental health right now, we've been having some meetings, some sort of drop-in sessions with DSPs working in the sector. And as things are opening up, when everything shut down, it was very black and white, right? There's no option for that right now. Everything is closed. No. But now it's like, well, maybe, or yes, for some people, or this is happening, or it could go really well like this, but it might not. There's a whole new level of uncertainty that we're experiencing right now. And I think that's also impacting our mental health in a different way. So kind of keeping tabs on ourselves and what's happening and recognizing how we change over the course of the pandemic is really important.
Yeah, absolutely. Absolutely. One of the things that I've noticed as a person with a disability is that when I go into an environment where there's other people, there's a mall just across the street from me, and I go over there every now and then just to get some pushing in and get some exercise in. That people are reacting to me with much more anxiety than they did before, and I think that's because they see disability as illness and illness as COVID, I was really surprised the degree to which people have changed just towards my presence being in a space. But that's just simply a new challenge that I'm going to have to deal with.
Right.
So do we have another question, or is that it?
We have another poll.
Oh, let's do the poll.
Let's do the poll. We got some resources that Dr. Luncey is going to give. So hold on. Here's the poll, and here we go.
Have you seen examples of mental health pressures for the people you support? Yes, no, or unsure?
Interesting. I added the unsure.
Yeah, I'm glad you did.
Yeah, because it can be tricky, right? It can be very tricky, as we've just discussed in some ways. Oh, wow. Okay, here we go. I'm going to close the poll. We've got 70% voted. Okay, here are the results.
79% said yes, 4% said no, and 17% said unsure. So what's your reaction to that, Yona?
Yeah, I mean, I would say, you know, most people are really using that lens already of looking for mental health issues, which is a good thing, because there are mental health pressures. Some people maybe won't show them as obviously as others, so that might explain some of the people who said no or unsure. But it's certainly something that's happening. And it was seen, you know, in the amazing survey results that were summarized through the survey that you did toward the beginning of the pandemic in the US. You know, people were reporting, DSPs across the country were reporting sort of examples of some of these things. So it's definitely happening. We're seeing it in Canada as well. It's obvious why it should be happening. And there's a lot of stuff we need to do about it before I think things get worse.
Yeah, absolutely. Absolutely.
Yeah.
So here,
so I think the last slide has just some examples of resources. So we can put this web link in the chat box. So the program I direct in regular times is called HCARD. But we set up really quickly a page where we've tried to put resources, and I'm sure you're all familiar with different resources in your own agencies or where you live. But these resources are either health related around COVID for people with developmental disabilities or mental health related. And we've tried to put in a number of things to support mental health. And we also have like a YouTube channel with a number of videos and things like that as well. But this is highlighting a series that we adapted for Canadians that actually came out of a series that was developed by some colleagues in Scotland. And they're just really beautiful booklets that you can print or look at on the screen to talk about some of the things that are going on right now in terms of COVID and how it's affecting people. So, you know, one of them, obviously sleep is a huge issue for people now, trying to sort of do problem solving when there's a difficulty, trying to get engaged and be active when you might be stuck at home, and then just ways to deal with depression and anxiety. So those booklets are helpful, talk about a sort of diverse range of situations, and you can kind of see yourself in it and think about some things that you can do. So that's just one example of a resource that we have that people might find helpful.
And for direct support staff, if I might plug you, at NADSB, the Facebook page that you operate, John, I think is a really good place for people to go and discuss and meet other DSPs. And it's an opportunity for people to talk about what they're experiencing and get a sense of community. So I would recommend, I go there quite regularly, and I would really recommend that to anybody who's listening. So it's the Facebook page of the National Alliance for Direct Support Professionals.
And there's videos as well from staff. There's a lot of really fantastic resources and things as well on the website. I know we put that in our article, Dave, because I was so impressed with many of the things that you've been developing very rapidly, you know, over the last couple of months. And I think that stuff really makes a difference. The more we can be sharing information and exchanging and learning from each other, the better.
Yes, absolutely. Absolutely.
Without a doubt. And let me just add one thing about that. Well, not about Facebook page necessarily, but something that is going to be coming out, a study that was done by the University of Minnesota. We surveyed close to 10,000 direct support professionals throughout North America. And out of that, the survey was intended to find out what's going on in the hearts and the minds of direct support professionals, and obviously in their service and support to people with disabilities. And the results, there's very pointed questions that were asked and so forth. The full results are going to be out sometime in August, September. It's one of the most, I guess, as research projects go for the University of Minnesota, it's one of the most, they've never had this kind of response. And
Yeah.
it's 10,000 people responding to these very pointed questions about COVID, and some of the questions deal with mental health issues and other things. But be on the lookout for that, everybody, because that's going to be, again, I think a look into how complex it is to be a direct support professional, and especially when a pandemic hits. And you said it earlier, Yona, the heroes, right? We hear it a lot, the heroes, the heroes, the heroes, and we get that. But we also, on a policy level, see that these heroes are being treated like zeros in some ways, right? But between the pay that they get, the development and opportunities for education that they get, that's why we're so happy to have this kind of forum to give direct support professionals some tools, right? Because largely they're not given these important things. So we're just thrilled. We're just thrilled that we're able to provide this kind of what we believe is a service to direct support professionals. So we're appreciative. I think we're about, yeah, we're at the kind of end of our, do you have any final words, Yona or Dave?
I just want to thank everyone for spending the time listening to this topic and thinking about it, and you know, keep reading, keep connecting, keep learning.
Dave, for you?
What she said.
Oh, that sounds good. And I just got in the little chat box here, people listening in from, get ready, Pakistan and New Zealand.
Wow.
So this is the International Journal for Direct Support. So thank you. Thank you all for listening. And to Dave and to Yona, specifically today to Dr. Yona Lunsky, thank you so much for putting this piece together. Dave, as always, thanks to you and to Angie for editing and getting these journals out to the world and to the universe. They make us all better, and so we appreciate you very much. And we'll see you next month. In the meantime, check us out at nedsp.org. Please keep yourselves safe and sound, both physically and mentally, because we need you, direct support professionals. We need you desperately. Thank you all, and we'll see you next month. Bye.
Bye.
Bye.